And then last question, in regards to card holders, right now, there seems to be somewhat of a barrier for access for patients who want to access cannabis, whether they have to see a doctor or the financial constraints of getting a license. Do you guys know if the funding aspect of supporting the legalization or the medical aspect of cannabis has been an issue in your perspective, whether it's funding from the legislature or in terms of folks in poverty or lower income?
For the medical use program right now, the way that it stands, we have always said that the program itself could be self-supporting. And I believe that that was the legislature's intent originally when they stood up the medical, at least the dispensary licensing and the patient registry system. We currently, our positions are general funded now, but all of our operational costs are by special funds. And the special funds, the source of the special funds are patient registrations and the dispensary licensing fees. With regards to the cost to the patient, please know that a medical use card only costs a patient, a Hawaii resident patient, $38.50. The bulk of the cost is from medical provider certifications. And the problem is just that there's still a lack of appropriate education of medical providers to have them feel a lot more comfortable about certifying patients. So what we have instead are doctors who specialize in, doctors and nurses who specialize in certifying patients for medical use. So that actually is one of the first educational programs that we're trying to stand up. I mentioned that we have an epidemiologist. She's also, we just brought on a contracted health educator, and they are working together, and that's basically one of the first things that we're trying to implement is to improve education for medical providers so that more of them will be comfortable about certifying patients and doing it as a course of their usual practice. It is concerning to the health department that while the medical providers who specialize in patients, certifying patients for medical use, they're not the treating physician. So, patients will have a certain medical condition that qualifies them for medical use, but they are going to another provider to get certified. And it is concerning to the health department because we don't know how much the actual treating physician knows about what their patient is using, what types of products they're using, and what, and properly adjusting maybe other medications that they may be using. So we really do think that there is a need for medical provider education.
Thank you. Thank you, Chair.